Stress-related hyperacidity. Stress may not actually cause stomach disorders, but it can exacerbate them. Unhealthy reactions to stress can cause pains throughout the body from muscle tension and constant worry. Tense feelings, anger, negativity, and anxiety may lead to stomach problems, including stomach acid difficulties. Stress can aggravate stomach acid production, resulting in chronic heartburn or acid reflux. Heartburn, also called acid indigestion, results from stomach acid that rises up into esophagus. It causes a burning sensation in the chest and throat. Some people who suffer from frequent heartburn have a condition known as gastroesophageal reflux disease, or GERD. Causes: idiopathic, prolonged ingestion of aspirin or some anti-inflammatory drug. Prolonged alcohol ingestion. Eating of spicy and highly acidic foods. Stress. Smoking. Symptoms: belching, nausea, bitter taste in mouth, vomiting, and loss of appetite. Feeling of discomfort and constant pain may occur in the upper abdomen. Anxiety, tension, and worry. Feeling of sickness. Constipation. Treatments: abstinence from smoking and alcohol is a must. Avoiding stress. Eating bland food and refraining from unnecessary medication. Medications such as antacids for temporary relief, H2 receptor blockers, and proton pump inhibitor are also prescribed by doctors to control hyperacidity. Ulcer. A peptic ulcer, also known as peptic ulcer disease, is the most common ulcer of an area of the gastrointestinal tract that is usually acidic and thus extremely painful. It is defined as mucosal erosions equal to or greater than 0.5 centimeters. Ulcers can also be caused or worsened by drugs such as aspirin, ibuprofen, and other NSAIDs. Causes: heredity, Helicobacter pylori, NSAIDs or non-steroidal anti-inflammatory drugs. Smoking, chronic stress, alcohol, duodenogastric reflux of bile. Symptoms: epigastric pain. Pain is referred to the epigastrium and is often so sharply localized that the patient can indicate its site with 2 or 3 fingers, the pointing sign. Hunger pain. Pain occurs intermittently during the day, often when the stomach is empty, so that the patient identifies it as hunger pain and obtain relief by eating. Heartburn, loss of appetite, vomiting. Treatments: medications, H2 blockers, antibiotics, proton pump inhibitors, mucosal protective agents. Surgery. The most common types of surgery for ulcers are vagotomy, atherectomy, and pyloroplasty. Vagotomy involves cutting the vagus nerve that transmits messages from the brain to the stomach. This interruption reduces acid secretion. Antrectomy removes the lower part of the stomach, which produces a hormone that stimulates the stomach to secrete digestive juices. This enlarges the opening into the duodenum and small intestine, enabling contents to pass more freely from the stomach. Pyloroplasty. This may be performed with a vagotomy.